Well, we would like to welcome everybody to our second annual Allied Digestive Health CME conference. My name is Mirchandani. I'm one of the partners at Allied Digestive Health.
Good morning, everybody. My name's Colin Brown, also one of the partners at Allied Digestive Health.
And I guess whenever you end up having a second of anything, that means at least the first one went okay. So we're back for round two this year. We have our venue here overlooking the beautiful New York skyline. So we're enjoying ourselves so far this weekend. For us, this has been a really good endeavor between Colin and myself. We've enjoyed putting this meeting together with obviously the help from Focus Medical Communications. The idea behind this podcast, this venue and this event came 2 years ago at DDW. All of us enjoy the national meetings between ACG, DDW, but the practicalities of venturing out to California, Florida, wherever these national meetings are, became a little tricky. So, a few of us started talking a couple of years ago and said, is there any way we can bring a academic meeting to us? As Allied Digestive Health has grown through the last few years, we've increased in size and scale, and, we have, opportunities locally and great academic programs locally. So we said, can we bring the experts to us? Is there any way that we can do this? And over the last couple of years, we've been, fortunate to have good partners, have good response, and our ADH physicians have been very excited about having these conferences locally.
Jay, you put it perfectly. We really are privileged to be able to bring these experts to our community, again, in this fantastic location in Jersey City. And I'll say that as community gastroenterologists, we do have kind of our own unique challenges that we face as we're managing our patients over years, if not decades. And, for the educational conference, what we really wanted to do was assemble a curriculum that would help us and give us insights into treating our patients, not just for a month, not just for 6 months, but really for years. And, so much of our lives, right, are lived through our digestive tract. And, while other chronic diseases, you may have them, you may not know it, with GI disease, that is not the case. If you have GI problems, you are very aware that you have GI problems. And I think it's so important for us to be able to have an updated toolbox. And that's what this conference is all about. It's basically helping us get the insight and the information so we can take that from here and then apply it to the patients that we see and that we see over years. So I'm really excited to have this conference today. We have a great agenda. We have 2 independent talks about liver disease. One, obviously, a very well-known and well-recognized phenomenon that's increasing in scope and scale, which is metabolic-associated liver disease. One about primary biliary cirrhosis and some exciting new therapies that are involved with that disease process. And then we have 4 separate sessions, one focusing on esophageal disease, one focusing on functional and irritable bowel syndrome, one focusing on GI tract infections, and the other one focusing on inflammatory bowel disease.
Yeah, I mean, it's a great conference we've been able to put together. I think the one thing we all learn in community practice, we're all many years away from, or many of us, Colin and I, are many years away from our training. But you're always learning in medicine because things are changing, at light speed. And, new medications, new therapeutic options, new diagnostic testing, this is all happening in real time. We all see patients on a regular basis that, I may look at their medication list and they're on some brand new medication for diabetes or high blood pressure or something that I have not heard of that I will have to go and look up and learn about. So even in our own fields, we need to be learning constantly. And this meeting is one way for us to do that in a group session with our colleagues. And also, we're so lucky being where we are geographically, having access to the academic institutions in New York City and Philadelphia, where we have speakers coming from today, that they can be our network of referrals. So if down the road we have complicated patients or difficult patients or need something that we can't offer them in a community setting, which is, it does happen sometimes. We have now direct access and communication and relationships with some of these academic institutions. So this meeting has helped foster that as well for Allied Digestive Health.
No, I mean, I think it's terrific. I mean, as you said in the beginning, bringing all the features of a big conference to a more intimate setting where we're able to interact with some of these experts one-on-one. There's going to be ample time for people to ask their questions. And I think one of the things that we try to do in this conference is understand that we all have patients that are in our minds when we listen to these lectures. And, we're thinking about, all right, how do we best treat these people? Well, we have the opportunities to go up to some real experts in the fields, ask them individually about basically these cases that we struggle with, and we try to discern the best options for. So again, bringing people to our community and having this great opportunity for us to learn, to talk, discuss, and bring that back to our patients, I think is going to be, it's such a great resource for us here.
Yeah, we're looking forward to the meeting today, and hope everyone has a good session and learns a little bit.